Okay, so today we will talk about skull fractures. This is part 1 of a series called Head Trauma, where we will study things pertaining to neuroradiology. First things first, when do I suspect that the patient is having an underlying skull fracture? Clinically, after an injury, if the patient is having a bump on the scalp or on initial imaging you find a hematoma, now we will categorize these fractures. When there is one single line of fracture present, it is a simple fracture. Multiple fracture lines, it is a comminuted fracture. If the overlying skin is intact, it is a closed fracture. If there is laceration of the skin overlying, it is a open fracture. Now, radiological point of view, these fractures can be divided into linear, depressed, elevated, diastatic, and growing. Now let's see these one by one. So linear fractures are sharply marginated linear defects involving both the inner table and the outer table. Here in the bone window CT, we see a thin, sharply marginated, lucent line involving the left frontal bone. It involves the anterior wall of the frontal sinus without any displacement of the fracture fragment. Also, what we see here is the frontal sinus on the left is filled with blood. In the 3D reconstruction picture, we can better visualize this linear fracture. Now, when this linear fracture extends into the adjacent suture or synchondrosis and the bones separate, this is what we call the diastasis. Traumatic diastasis involving a synchondrosis is mostly seen in children. The most common synchondrosis to get affected is the spheno-occipital synchondrosis because it ossifies only after the mid-teens. Here we can see the spheno-occipital synchondrosis normal in the first picture and a separation between them, a diastasis between the basisphenoid in the second picture. So, now, these depressed fractures are usually secondary to a comminuted fracture where the fracture fragments are displaced inwards. These are usually secondary to a high energy direct blow to a small surface using a blunt object. This head CT picture in bone window and 3D reconstruction depicts a depressed fracture involving the left parietal bone. Elevated skull fractures are caused by sharp, long objects like a machete, which is shown here, or a propeller. The fracture fragments are lifted up and rotated. These are rare fractures. Here we see bone window CT head images where there is a fracture involving the left parietal bone and the fracture fragment has been lifted up. Now, growing skull fractures are also known as post-traumatic leptomeningeal cysts or craniocerebral erosions. These are rare and are seen in children less than 3 years of age. Now, this growing skull fractures, they occur in stages, stage 1, 2 and 3. From the point of initial injury till when the fracture just begins to enlarge is stage 1, where we see laceration of the dura and herniation of the brain and or the arachnoid tissue through the defect. From the time the fracture starts to enlarge till it becomes significantly larger is stage 2. Here we see a bony defect which is small right now with limited skull deformity, mild neurological deficits. Also, normal healing does not happen here because of the entrapped tissue present in the defect. Now, from the time the defect is significantly larger onwards is stage 3. Here, the brain tissue and the CSF extend between the bony defects of the fracture between the torn dura, leading to a significant skull deformity and progressive neurological deficits. Now, the stage 1 is also known as the prephase. Stage 2, known as the early phase, which lasts for up to 2 months from the point of injury, and beyond 2 months from the point of injury is the stage 3, which is also known as the late phase. Now, stage 1 defects are difficult to detect on imaging. Stage 2 and stage 3 shows loosened skull lesions with rounded scalloped margins and beveled edges, CSF and soft tissue entrapment beneath the underlying fracture, which is expanding. Sometimes the underlying herniated brain tissue may appear hypodense. That is because encephalomalacia that has occurred secondary to the trauma. Now let's see some pictures. Here is a scout image of the skull showing this scalloped lucency in the parieto-occipital region. The margins are rounded. CT shows a large defect in the region of the left parietal bone through which the brain tissue is seen to be herniating. In the brain window, you can see that this brain that has herniated is hypodense, that is a post-traumatic encephalomyelitic changes. In this 3D reconstruction, we can better visualize the defect and the growing skull. Okay, this was all for today. If I have missed out on anything, kindly let me know. I can add those things in my next video.